after pregnancy, what happens is we get into the issue of, breastfeeding and also the hormonal situation that happens right after pregnancy. And so obviously for the health of your baby and for you, breastfeeding is going to be highly beneficial. One of the things that happens is that breastfeeding obviously uses up additional calories, and it also has some hormonal effects that you should know about. So the first thing that happens is once your pregnancy is done, your estrogen and progesterone levels, and especially progesterone, which would have been elevated during pregnancy, will fall off. And one of the things that will happen is you'll start to increase your level of a hormone called prolactin. And one of the major things that prolactin does is increase milk production by the breasts so that the baby can begin breastfeeding. Prolactin also has an effect on slowing fat loss a little bit. So what it does is it slows the release of fat by the body. And this makes sense, right? Because essentially what the body wants to do is you still have this little infant living off of your body, so the body wants to assure that it has plenty of stores there so that you can have a situation where you're feeding that baby and that baby is well nourished. And so this is why oftentimes two things happen here. Different women report different things. You're obviously using up a lot of extra calories, and so you want that advantage while you are breastfeeding, because that might help you lose the baby weight a little bit quicker and assure a healthier recovery. But you also may be in a situation, depending on the woman, where you're releasing also some muscle. And so at this point in time, because of what prolactin does, and you're not burning up a whole lot of the fat as well. So this is all depends on the woman, right? Every woman is going to be a little bit different, but these are the effects you have. So some women will report they lose a ton of weight every time they breastfeed. Other women will say, well, once I weaned my baby, I lost even more fat at that point. So that's what's going on here. You have this prolactin effect and you have this increased calorie effect. We hear both things, but most women will notice if they've been exercising throughout the breastfeeding process, once they wean the baby, things may speed up a little bit. However, you want to look at things this way. The longer you breastfeed your baby, the healthier that baby will be and the less risk they have of ever being obese. And so you want to really breastfeed as long as is feasible for the health of your baby. And then once you wean your baby, you may have a little bit more advantage at that point in time in having some of the fat come off. And so at that point, what you want to begin to do is, as soon after as possible you give birth, walking becomes, again, the next best thing to do right away. So you're walking right up to the point where you give birth, and you're walking as soon afterwards as possible. And then as soon as your doctor gives the clearance, you go back into weight training and that kind of thing. One of the things that you want to understand here is that, again, you want to feed your body so that you can make sure that the baby's getting all the nourishment it needs, and that's going to help your baby in the long run. But this should help you understand this prolactin issue explains why a lot of women will say, every time I've had a child, it wasn't until I weaned them until I lost that fat weight. And so that is an important consideration to understand and is useful for breastfeeding issues.